Now let's look at the muscles that extend the fingers. There are three: a large one that extends all four fingers and two small ones for the index and little fingers. The large one is extensor digitorum, sometimes called extensor digitorum communis. It arises from the common extensor tendon and thereby from the lateral epicondyle. As it passes distally, it divides into four slips, which pass together under the extensor retinaculum. We'll follow them beyond there in a minute. The extensor muscle to the little finger, extensor digiti minimi, arises from the ulnar side of extensor digitorum and passes under the retinaculum by itself. The extensor muscle to the index finger, extensor indicis, lies deep to extensor digitorum. It arises from the ulna and the interosseous membrane. Its tendon passes under the retinaculum along with extensor digitorum. Emerging from beneath the extensor retinaculum, the extensor tendons fan out. As they approach the MP joints, they branch and rejoin in an irregular fashion. Extensor indicis and extensor digiti minimi join the respective extensor digitorum tendons as they reach the MP joint. Here at the MP joint, each extensor tendon gives rise to the extensor hood, then divides into three parts, as we saw when we looked at the extensor mechanism a little while back. The extensor muscles produce extension at all three joints of the finger. Their main effect is at the MP joint. As we'll see later, the interosseous muscles and the lumbricals also have major roles in extending the interphalangeal joints. Now let's move on to look at the long muscles of the thumb. The thumb has a long flexor, a long abductor, and two extensors, a long one and a short one. The long flexor, flexor pollicis longus, lies deep in the forearm. We'll remove flexor digitorum superficialis to see it. Here's flexor pollicis longus, lying alongside flexor digitorum profundus. It arises from the anterior surface of the radius and from the interosseous membrane. Its tendon passes through the carpal tunnel with the finger flexors. Here's the tendon of flexor pollicis longus emerging. It enters the fibrous flexor sheath of the thumb and inserts on the base of the distal phalanx. Flexor pollicis longus flexes both the MP joint and the IP joint of the thumb. The other three long thumb muscles lie on the extensor aspect of the forearm. They lie deep to extensor digitorum, which we'll remove. This is the long abductor, abductor pollicis longus, and these are the extensors, extensor pollicis brevis and longus. The abductor arises from the radius here and also from the interosseous membrane. The two extensors arise a little more distally, the short one here, the long one here. Now we'll put extensor digitorum back in the picture. Here it is. The three thumb muscles emerge obliquely from beneath the extensor digitorum. Their tendons pass beneath the extensor retinaculum, extensor longus by itself, the other two together. The tendon of abductor pollicis longus inserts around here, on the base of the first metacarpal. Extensor pollicis brevis inserts on the base of the proximal phalanx, and extensor pollicis longus inserts on the base of the distal phalanx. The movement produced by abductor pollicis longus is a combined abduction and extension, occurring at the CMC joint. It's the reverse of opposition. Extensor pollicis longus extends the IP joint and the MP joint of the thumb. Extensor pollicis brevis extends only the MP joint. Now we'll move on to look at the intrinsic muscles of the hand. They're in four groups: the interosseous muscles, the lumbricals, the short muscles of the thumb, and the short muscles of the little finger. There are 7 interosseous muscles, or interossei. Here they all are together. There's one for each side of the index, middle, and ring fingers, and one for the radial side of the little finger. By tradition, They're divided into these 4 dorsal interossei and these 3 palmar ones. But to understand what they do, it's simpler to consider them in twos, like this. The 2 interossei for the middle finger are a typical pair. They arise from the shaft of their own metacarpal and from its neighbors. They pass behind the deep transverse metacarpal ligament. We'll remove the ligament, and we'll also remove the other fingers and metacarpals to simplify the picture. On each side of the MP joint, the interosseous muscle narrows down to a double tendon, which has a long part and a short part. The short part inserts here, on the base of the proximal phalanx. The long part of the interosseous tendon joins the extensor mechanism to become its most outlying part. Merging with the lateral slip of the extensor tendon, it forms the lateral band of the extensor mechanism. The 2 lateral bands come together distally, as we've seen, to insert here on the distal phalanx. The line of action of the interosseous tendon passes in front of the axis of rotation of the MP joint, marked by this pin, and behind the axes of the 2 IP joints. When the 2 interosseous muscles of a finger contract together, their action is to flex the MP joint and extend both the IP joints. When one of the interossei contracts separately, it produces either ulnar deviation or radial deviation at the MP joint. The many fine gradations of finger movement are produced by complex interactions between the interossei, the lumbricals, and the long flexors and extensors. The interosseous muscle on the radial side of the index finger is unusually large. It's the first dorsal interosseous muscle. It has 2 heads, which arise from the first and from the second metacarpals. The radial artery, coming round the side of the carpus, passes between its 2 heads, as we'll see. The first dorsal interosseous produces powerful radial deviation of the index finger. It's one of a pair of intrinsic muscles that are strongly involved in this action, called key pinch, as in holding a key. We'll see the other one of the pair, adductor pollicis, when we look at the thumb muscles. Let's move on now to look at the 4 lumbrical muscles. Here are the lumbricals, one for each finger. Each lumbrical muscle arises from the side of one or both of the adjoining flexor digitorum profundus tendons. The lumbricals pass in front of the deep transverse metacarpal ligament. Each lumbrical inserts on the radial side of the extensor mechanism, just distal to the long part of the interosseous tendon. The action of the lumbricals reinforces the action of the interossei in extending the IP joints. They also assist in radial deviation of the MP joint. Now we'll move on to look at the 4 short muscles of the thumb. One of them lies by itself, and 3 lie close together. The one that's by itself is adductor pollicis, the other key pinch muscle. Adductor pollicis has 2 heads, a transverse head and an oblique head. The transverse head arises from the 3rd metacarpal. The oblique head arises from the ligaments in the base of the carpal tunnel. Adductor pollicis inserts on the ulnar sesamoid bone and on the base of the proximal phalanx of the thumb. Adductor pollicis produces adduction at the carpo-metacarpal joint. The other 3 thumb muscles make up this bulge that's called the thenar eminence. Collectively, these 3 are called the thenar muscles. On the outside are flexor pollicis brevis and abductor pollicis brevis. Deep to them both is opponens pollicis. Abductor brevis arises from the trapezium and from the flexor retinaculum. Flexor brevis arises from the flexor retinaculum and from the trapezoid. These 2 muscles insert here on the base of the proximal phalanx of the thumb on the radial side. Opponens pollicis, here it is by itself, arises from the trapezium, and from the flexor retinaculum, and inserts along the radial side of the first metacarpal. The three thenar muscles overlap, and their actions overlap too. Between them they produce abduction and flexion at the carpometacarpal joint, bringing the thumb away from the second metacarpal and across the palm, and thereby also rotating it medially. As we've seen, these movements add up to opposition of the thumb. Lastly, let's look at the three short muscles of the little finger. They make up this smaller bulge, the hypothenar eminence, and collectively they're called the hypothenar muscles. They're arranged in much the same way as the thenar muscles, and their names are similar. On the outside are abductor digiti minimi and flexor digiti minimi. Deep to them lies opponens digiti minimi. The abductor arises from the pisiform bone and inserts, just like an interosseous muscle, partly into the base of the proximal phalanx and partly into the extensor mechanism. The flexor arises from the hamate bone and the flexor retinaculum and inserts near the abductor on the proximal phalanx. The opponens arises from the hook of the hamate and inserts along the ulnar side of the fifth metacarpal. The ulnar nerve and artery pass underneath the flexor and opponens as they enter the hand. The abductor has the same actions as an interosseous muscle. The flexor helps to flex the MP joint, and the opponens produces flexion of the fifth metacarpal at the carpometacarpal joint. These three muscles help to make the little finger specially mobile.